welcome to Inside Edition to discuss national, regional and international issues in depth. A long-term plan aimed at providing better quality medical services and putting a cap on government medical spending by 2038 will start with the new National Health Insurance Scheme. The Supreme Council for Health plays a major role in further improving the health sector in the Kingdom of Bahrain and has worked throughout the past years on creating the suitable environment to reinforce the quality of services. It also worked on maintaining the sustainability of medical resources in addition to coordinate with public and private sectors as well as cooperate with relevant international health institutions. For further elaboration, we are joined by Mr. Ebrahim AlNowakhtha, the Secretary General of the Supreme Council for Health. But first, this for more.
Bahrain launched its national health plan, setting the strategic roadmap for the future of the healthcare industry in the kingdom for the next decade. The plan is a realization of the Supreme Council of Health's strategic responsibility of setting the framework for the provision and quality of healthcare services.
The health strategy actually is the way to achieve the objective or the 2030 vision of Bahrain, and it's mainly actually to provide all Bahrainis, the citizens and the people actually living in Bahrain with a kind of services, health services, which is with good quality, with equity and sustainable and also competitive. And that's, I think, the main important mission that we are actually achieving.
The plan revolves around 7 key pillars, including improving healthcare safety and quality, enhancing the method of care delivery, ensuring a sustainable healthcare funding system, investing in training and capacity building, and building an integrated national healthcare system. It is the first of its kind on the national level.
Our health plan consists of 7 main priorities, and under each priority there are 7 strategic objectives, which consist of many initiatives and programs and projects related to all health sectors, from the public and military and the private sector.
The plan brings together public, private and military health institutes and is based on their synergy to arrive at its objectives of providing sustainable and quality services to the citizens and residents.
Welcome back. With us in the studio is Mr. Ebrahim AlNowakhtha. Thank you very much for joining us today.
Thank you for inviting me. Thank you very much.
Mr. Ebrahim, the roadmap for the health insurance scheme or the health insurance project is expected to improve services to the people that need the healthcare service here in Bahrain, and it's been in the works and planning for a long time. What can you tell us about how the idea started and how it is going to provide better services for the people?
You see, the health sector in Bahrain, especially the public health sector in Bahrain, has started early last century, and since then a lot of improvement has happened during the years. And around the late 1960s, the opening of the expansion to the Salmania Hospital happened. Mm-hmm. And indeed, with recognition of worldwide organizations that the health sector in Bahrain is delivering a very good primary care and secondary care services, meaning in the hospitals and at the health centers. Mm-hmm. But through the directions of the leadership, we always want to see how we improve the service. We cannot stay static and just wait for things to evolve, as you know that the world is evolving around us. Of course. And the health sector itself is an ever-changing sector. So there are new treatments, new drugs, new equipments that need to be somehow integrated within the system to improve healthcare. Mm-hmm. The other thing is it is very important to find means of financing the health system to ensure the sustainability of the system. When we say financing, we don't mean that we need to generate money from different, no, but we want to see how effectively we can use the money we have, the resources that we have, and put it in the right place to improve quality and improve the safety of patients. That is the essence of the whole program. So the idea came of how do we use the resources that we have. Okay, Bahrain, known to have invested in the last, let's say, about 100 years in healthcare sector, but it is important that we see that we are investing the money in the right way to improve the health of the patient. To us, The government of Bahrain look at the Bahrainis are indeed a main pillar of development as such. So health is very important. Health safety is very important and key. The same applies for the expat, which are partners in bringing up this nation. So the health insurance system try to put the elements or the goals to improve healthcare for all.
Yes.
And that is the sense of it. Comes from there.
Mr. Ebrahim, one of the main things that we see where the development has shown very strongly are the primary healthcare centers. And as you said, the resources are available. It's like just a means of distributing them better. So primary healthcare centers have taken off a big load from the major hospitals when it comes to services that are on daily basis provided. What can you tell us about the improvements to the primary healthcare centers?
You see, I think it is important to say a fact and not a fictional fact, but it's a fact. You know, Bahrain has a very strong primary care health center which was built over the years, mainly because we do a good gatekeeping system, you know, and prevention has been part of the healthcare for many years. Indeed, I think it is important to understand that without a primary care system, okay, or a gatekeeping system, then you will have a lot of problems upstream, which is the hospitals. You will have much load going to the hospital, shifting all the load to the hospital where you need much more acute care there. Yes. So, yes, you have to appreciate in a small island of the size of Bahrain, we have now around 28 health centers, okay? This is a big achievement. And if you go around the world, okay, and you look at the health centers, in many standards, you know, international standards, our health centers are like mini hospitals, frankly. True. We have many of them around the country, not only the major 5 in each region, but some of them even, they do specialization services at the health center. But, as I said, you know, you cannot stay stagnant and say we have. I think it's very important to see what is the way that to improve, because if you stay stagnant, people will pass you. Then healthcare will somehow suffer, because, as I said, you know, things are changing, new diseases coming in, new treatment coming in, and you need to improve. This is one. The second one is, how do you utilize your resources? You have the financial resources, you have the human resources. You know, how do you utilize this? And third is very important as well, is to give choice to people. You know, we need to move from what we are doing now, and that is people of the same region only can go to a specific center to a specific doctor, but try to give them more choice in choosing their doctors, and hopefully in the future even going beyond, you know, going beyond the region and selecting doctors in different regions. It is left to the patient to give him a choice. This is one of the main goal that we are trying to achieve by implementing the social health insurance. So yes, improvement to the primary care is a key. It's important, because you don't want people to become sick. You need to be creating a very strong primary care system, which creates a very strong preventive care system at the end of the day.
Like most of the services fields that service humans and citizens of Bahrain and all the world, the healthcare sector is a ever-evolving one, depending on the technology, the evolvement of diseases, the evolvement of vaccines, all that kind of things. What are the expected changes within the health system that the implementation of the health insurance project will bring?
I think this is a good question, but to address it, I think we need to explain to the viewers what do we mean by social health insurance system, because there are a lot of confusion, you know, with people. You know, we need to do our role to try to explain to the people, you know, what we mean by social health insurance system. So if you allow me, I mean, I'm trying to explain the concept as a whole. You see, there is a goal set by the government. As I said, there are key goals we are trying to achieve with the social health insurance. First of all, create choice, which I talked about earlier, but I will try to explain it better. Find a mean of sustainable financing of the system, raise quality, okay, develop or build up the capacity planning of people, and control let's say expenditure as such, and put the expenditure in the right directions. So all these things are very key important factors that you need to do by implementing the social health insurance. So we try to learn from the experience of others, how do we develop a system whereby both the national and the expat really gain from these things. So the idea is to create a system where the government, the main change is to the people is the government is going to fund still for the national, still going to fund the system as such. So the Bahraini will not pay for the service. He will have a choice to go to hospital. So this is one. He will have a choice to go to the public hospital. So before he might be restricted to going to one hospital. In the future, no, it will be more than one hospital because you are a paying patient. The government is paying for you, but you are a paying patient. So when you walk in, you go inside the hospital, you'll be treated, and there will be like the bill for you.
Yes.
That bill will be printed, given to you, but you will not pay it. The government will pay. So you will not pay anything, nothing, not even for medication.
Yes.
So the whole treatment, including the stay, the treatment, the consultation, the drug, all will be paid by the government. You will know how much. That bill will go to the government. We will create a fund, which is like a big insurance company.
Exactly.
That insurance company will address the bill from the provider, will check for the amount and for the quality of the service given, rendered to the patient. Based on that, the payment will be done. So this is for the Bahraini. So what we did, we gave a choice. So the patient, when he goes in, he will be treated and the fund will pay.
Yeah.
Because you gave a choice, no one hospital will be assured of patient coming to him because he has other direction. If you are not giving good quality healthcare, then he has another choice to go to another hospital. So you will really work hard to improve your quality because you want the patient.
Or if you have a specialized field within that hospital itself that is not provided by other providers.
Yes, yes. So in that way, you slowly improve the quality. So financially you are not affected, but because we introduce, this is the difference that the patient, they are saying, okay, if we are not paying, the government is paying. So what is the difference to us? Different is choice. Because of choice, quality will improve, and so on. Each element is tied to the other, and this is for the Bahraini. For the expat, we are trying to ensure that any person living on the island is somehow protected against any health matters. You don't want them, any person having becoming sick and then he doesn't have the money or he cannot support his treatment as such. So it is now incumbent on the employer to pay, for the insurance of this individual. Again, we have different packages based on the salary scales of the individuals, and then they will have access as well to healthcare. But for the expats, it's a bit different. Bahrainis don't pay.
Yes.
The expat, the employer will pay. The Bahraini has a choice to the public hospital, and he will go there and will be treated without paying what we call a co-payment, meaning he doesn't pay part of the bill, where the expat will be expected to pay part of the bill, and so on and so forth.
We're going to talk a little bit about the international cooperations, but can you tell us about local cooperations between the private and the public sectors?
You see, I think as I've highlighted from beginning, this is a health sector, and it's not public sector or private sector. We are trying to the Supreme Council of Health, when it was created by royal decree by His Majesty, the idea is to bring everybody to coordinate together for the whole sector. The idea was as well to put a strategy for the whole sector. So we cannot work in isolation from our partners. We are, put it this way, we are not representing a sector, just a public sector or private. So we need to work with everybody to make things work, make things really work at the same pace as well together. So the private sector, we look at the health sector as you have the hospitals, you have the clinics, and then don't forget the pharmacies, part of it. Don't forget that insurance companies which give health insurance is part of it. So all these have been our partners, and I hope they have felt the magnitude that His Excellency Sheikh Mohammed has put to make sure that even before introducing the law, how much input that he has taken to really reflect it in the law and take ideas that has been coming through them. So we had a lot of meetings with them, listening to them and trying to really bring the law which serves and take the aspiration of everyone.
Yes. During the first public forum discussing the National Social Health Insurance Program, Sehati, the President of the Supreme Council of Health, Lieutenant General Dr. Sheikh Mohammed bin Abdullah Al Khalifa, said the new health insurance plan ensures that citizens are given the best quality services in accordance to the main guidelines of Bahrain's Economic Vision 2030.
This project actually, the main purpose of it actually serving the people, and I think that we need actually to tell the people what they are going to get, what's the difference between what they are getting now, what they are going to take in the future, what advantage they are going to have, with the new system, what advantage the system as a whole, as a, the health delivery is going to change and become much more effective, much more responsive to the patient and to the customers. This I think that we need to pass to the people, and the other side actually, the way of the controlling the expenses and the quality of the system is very important, and that I think this system is going to work in this direction and very effectively.
After watching that, one of the things that we also want to illuminate here is the role of the Ministry of Health in providing all of these services for the citizens, and in even providing the statistics and the information needed in order to improve the healthcare plan. What can you tell us about the role?
I think you cannot isolate the role of the Supreme Council from the role of Ministry of Health. We are partners into this. Indeed, the deputy to our chairman is the Minister of Health, and I must say from this platform that the support we have got from the Ministry of Health as a whole, has been forthcoming and overwhelming, to be frank. And yes, there is going to be a magnitude of change, and without the support of the Ministry of Health, I think this project will really face difficulties. We talk about restructuring of Ministry of Health, because in the future, the hospitals, as I explained earlier, they will be somehow operating like a semi-private, what we call autonomous, meaning having more say in what they do. So they will be isolated from Ministry of Health. They will be standalone hospitals reporting to a board of trustees, which belongs to the government. It's not private, still under government, but isolated from Ministry. Ministry of Health will have more of a regulatory, more of supervisory, more of strategy sitting, working very closely with and looking at the public health and health promotion as such. These are key functions that Ministry of Health will do. But at the same time, it will have to monitor the whole system, how it's operating through HICMA and so on and so forth. So their role is key. Yes, we will carve some of the functions out. That is to give more autonomous, because we want the hospitals to be responsible and given the ability to run itself. So it will be more questionable and accountable to the function it does by giving it more as well response. So you need to give authority to hold accountability. So these are key functions that we'll do. Yes, Ministry of Health is will say, I will say that, I will not say a partner, but they are with us step by step in implementing the social health insurance together.
A very important collaborator and cooperator with the health scheme is the international community. The Supreme Council for Health places a lot of importance on the international outreach activities and the effective cooperation between the regional and the international health institutions. How did the Council benefit from the international experience in preparing this insurance project?
As they say, we are not here reinventing the wheel. The idea, it all stems from what is known in the health world as universal health coverage. Many nations before us have introduced health insurance or universal health coverage, and when we started the whole exercise at the beginning, what we did two things. First of all, we tried to work with international organizations like WHO, World Health Organization, or the World Bank. The World Bank have very good experience in implementing health insurance around the world, and other bodies, and other countries as well. So then we decided to bring a consultants to help us in putting at least options of how to move forward. And that partner was the World Bank.
Yes.
They have their own health verticals in the World Bank, so people get confused when we say a bank. They get confused about the role. Yeah. So they have as I said, their own vertical in healthcare, and that healthcare let's say vertical is responsible to address health issues all over the world. They came in as a consultant.
Yep.
They didn't play a different role. It's just as a consultants that the government of Bahrain have requested them to come. During that phase, they put a study out, and they gave 7 options to the government of Bahrain, and they said it's up to you to select which option. Based on those 7 options, the government of Bahrain decided to select an option. Actually, they created, let's say, their own options as well. Based on those options, they mixed 2 options together to come up with the option that we are implementing in Bahrain now. We don't have a single payer system here, but at the end of the day, we have a multi-payer system for the health insurance system that we are proposing in Bahrain. So that was the role of the World Bank. The other part was World Health Organization. His Excellency, both His Excellency Sheikh Mohammed bin Abdullah, the chairman, and Her Excellency the Minister of Health, Faiq Al-Saleh, have been very, very instrumental in making sure that the input of those organization or WHO has been forthcoming. We had visits from them coming to Bahrain, and we had visits going to Cairo for the regional office and trying to get their input. And we have their consultants going in and out of Bahrain, trying to help us and direct us to the best way to go. So, as I said, we are not reinventing the wheel. We are trying to learn. But I think the most important thing to bring to the table now is the experiences we had from the people around us. Okay? So we looked at the Gulf states. We've been to Saudi Arabia, and they came here to Bahrain. The UAE, the same thing, the same story. We have the same thing. We went to try to learn from the Kuwaitis, and indeed, we are trying to work with all the GCC countries to understand from them. Some countries have made headways better than us, as a country, because they started their health insurance, before us. So we've learned a lot, to be frank. We've learned a lot. I think the idea was to look at the challenges, the issues that they had, and we try to learn from those issues and not to repeat them. So we really appreciate their support and their input, and we are continuing it. We are going to have a big conference in November this year, where it's called the first GCC Health Insurance Conference. Will be held in Bahrain, but it is the GCC and all these countries that I mentioned. Ministers from those countries will be here, plus ministers from countries that we've gained a lot. We worked with Turkey, we worked with the Korea, we worked with Thailand, so we learned a lot, and those people are working with us day and night, to be frank. They're very supportive to us.
Yes. I'd like to elaborate on this fact, particularly when it comes to healthcare. The regional experiences are important because depending on the region, it is also the services, they tend to be the same. The GCC has had a very big role in each other's healthcare services, Bahrain in the GCC countries and the other GCC countries in Bahrain. What can you tell us about specifically the GCC cooperation together?
I think we are lucky. We are lucky because we are in the GCC, culturally we are very close, and system-wise we are very close. And the leaders of these countries, they work very close to improve not only the healthcare, but the standard of living of everyone. So, and then, frankly, working with these countries, you feel that the doors are opening to you easily. People try to talk frankly about their challenges. We might differ in one way or another, yes. The systems might differ, but at the end of the day, you find out that the goals or the direction or the objectives of what you are trying to do is the same. Yeah. We have the same demographic issues, we have the same cultural issues, we have the same, and because of the support that we get from these people to open their doors and share their experiences, the same, what we do in Bahrain. So I think when we sit on one table, we feel that we are just, you know, having a chat and trying to explain what are the challenges and so on and so forth. That has helped a lot. You know, as I mentioned, Abu Dhabi and Dubai have made headways. You know, they've started the program for a long time, and they learned a lot. You know, nobody starts a program of this nature, and I promise you, I mean, even us, when we go through the program in Bahrain, it's not going to be, you know, all rosy picture. It's challenges. Things are not, it's going to be bumpy road, but we have to start. We have to think how we want to improve the system. No country in the world have implemented. A lot of people thinking when we say we'll implement the health insurance system on the expat, when we say we want to start next year, they think everything will be rosy next year. No, it's not that way. We will start and then we'll tune and so on and so forth, and to become to an ideal system where we think that the system will be sustainable and manageable and feasible to all. I think it's going to take time. It takes the support of everyone. You know, this healthcare is not confined to one entity. Everybody has to play his part. Patient, doctors, nurses, allies, and so on and so forth. Everybody has to play into the success.
Yes.
And the private sector is another means. So it is not easy to bring all these into one table and try to get an agreement.
Yeah.
Or find the final goal. So we will work together to get to the end. And as I said, the support of these countries are very important to us as well.
You hit the nail on the head with a massive program like this. The Supreme Council of Health is going to have a follow-up strategy, and because basically to ensure its success and to improve on it, this follow-up and the implementation of it is very important. Can you tell us a bit more about the strategy and its main pillars?
You see, the strategy itself is drawing the direction for the government of Bahrain for the next 10 years.
Yeah.
That strategy, which we call the health plan, we've worked with entities not only internal but even external before we devise it, and we try to make it objective, something that we can really achieve within the next 10 years. Okay, it's not something on paper, and we hope by starting the social insurance program will drive so many of these elements of the strategy to a goal. So, for example, one of the main pillars of that strategy is financial sustainability, okay?
Yes.
The second one is social health insurance. Capacity building is another one. Quality, patient safety. These are all pillars of the program, IT, okay? If you look at the reforms that we are trying to do in healthcare under the National Social Health Insurance, it encompasses all these ones under one big umbrella, okay? So yes, without these things, we cannot improve healthcare in Bahrain. So this is the direction that the government of Bahrain set under the plan, and this is the direction that we are trying to work and to achieve it, hopefully in the next 10 years. We are working hard to start implementation as soon as, of course, implementation, yes, but to attain the whole strategy within the next year. But of course, with like any strategy, we'll always go and refine it and study it and update it as you go along the road.
Yes. Mr. Ebrahim, these pillars, is there one that takes priority or precedent in Bahrain specifically? Is it patient safety? Is it the financial factor? What takes precedent right now in the healthcare system here?
Very good question. I think at the end of the day, you see, the whole pillars are integrated together, so you cannot do one without the other. Somehow they drive each other. But the aim at the end of the day is the quality of the service. You try to introduce a quality of service, very high quality, okay? This is one. But more importantly, you want to create a program where the health becomes something that is you as an individual take care of yourself, that you don't want to become sick. You know, we don't want to say, okay, let's improve the system stream, take care of yourself. Why don't we improve it beforehand? Yes. So if you look at the strategy itself, it talks about well-being. How do you really take charge of your life? If you notice, the name of the whole program is called Sahhati.
Yes.
Because we came with that name because we think it is your responsibility to look at after your health. Yes. We don't want you to become sick to look after you. We hope that through the primary care system that we are developing through the social health insurance program or the reform program, is go to the citizen even before he becomes sick.
Yes.
There is a lot of programs that we really put under the strategy where we help the individuals to look after their health by doing activities outside, okay, the norm, eating the right food, putting even taxes, you know, when people complain about raising taxes, because this is not because we are trying to penalize people or not, it's indeed to drive people towards better healthcare, better taking care of yourself, because nobody wants you to end up as a patient. We hope that it will be lovely to have a small island where everybody, you know, minimal people going to the even primary care.
Exactly. It's also important to mention when it comes to quality healthcare, Bahrain has very able manpower, whether it's doctors or other healthcare workers, but also there are things that the Ministry of Health, the Supreme Council of Health, and other institutions in Bahrain have focused on, like preventative medicines, as you said, and as well as awareness campaigns and awareness medicine. Can you tell us a little bit about the cooperation between institutions within Bahrain to provide this better healthcare system, this better social life where people become less sick, whether it is through social activities or the healthcare system itself?
You see, in the last, I think, in the last few years, as people have felt some programs that have started, you know, like there is has been cooperation between Ministry of Health and malls, for example, you know, centers where you have people going and practicing early morning, you know, walking around and things like this. This is sounds simple initiative, but frankly, if you look at it from a bigger scale, that if we can encourage people to such things, is good. But the Ministry of Health has been working on many programs, you know, the Stop Smoking program, making people realize the effect of the food that they have, the problem of not, you know, looking at your health from the perspective of sport coming part of your life.
Yes.
You see now many young people, you know, everybody's going and running to the gym. This is very, very good, but I hope they just keep away from, you know, building muscles in the wrong way. But these things really encouraging that people started to be aware of it, of taking care of themselves. The role of going back to your question, the role of different entities, Minister of Health is playing as much as it can, but I think there are many other entities, you know, you have to look at so many things that affect the human health. Yeah. In Bahrain, alhamdulillah, we have many organizations which looks into this. For example, the environmental council for the environment, they look at healthcare. They look at different aspects. You know, the air we breathe, the water we drink, and so on and so forth. Yeah. So yes, there's always room for improvement, and I think we need to all work together to improve as much as possible.
One of the branches that had a pivotal role was, or is, the legislative branch of the government. It gave full priority to support the Supreme Council of Health's performance. How can you evaluate, or do you evaluate this support, and how does it facilitate achieving the goals from this health insurance project?
I will talk from my personal experience. You know, when we developed the law with the input, as I explained earlier, from many entities, yeah, we took it to the Parliament, and it was really intriguing experience, because we had to work with them word by word, and when you go, they really put too much effort to at least represent not only the public into that, but at least even look at or go beyond and look at the interest of the whole nation. You know, how to make sure that we don't affect the whole system by just developing a system that might have loopholes here and there. So to be frank, you know, we worked with them weekends, nights, days. I know, you know, I want to be just to the hard work that has been put by the committee, you know, yeah, of the Parliament, and we worked for 2 years. It was not an easy ride, you know. It was a bumpy ride, but I think everybody had the interest of really looking at how to move the country into a new phase, a new direction. And I think for the 2 years, yes, it was a long, dwindling and cumbersome process, but at the end was always to find a way that we need to work together and put something that we will be all proud of. And I thank them. And not to forget the role of the Shura Council as well, you know.
Yeah.
There has been a lot of work happening in the background that people didn't feel it when things just came to happen in one night. Yes. We had the longest session in the parliament that night, and people might think that is what happened. No. Has been too much work going on, and I remember so many of the representatives of the parliament who have been calling us day and night, trying to tune here, tune there, put their input into every clause of the law. So yes, it was. I do thank them, and we are very appreciative for their role.
Yes, the parliamentary role is also. It wasn't the opinions or the inputs of the members themselves, but basically they represent the citizens and they listen to them, and they bring to the table the complaints or even the right doings that the healthcare system is doing, or what is needed, or what needs improvement, or what they want to stay as it is. What do you feel that the input that is coming basically from the citizens, are you receiving enough input through the parliamentary legislation, or are there other ways people can or voice their ideas?
I think the beauty of this country, you know, top to bottom, the beauty of this country is that everybody somehow knows everybody.
Yes.
And the way we mingle and talk together is there is no barriers, you know.
Yes.
Frankly, you feel this in the nation. That opens the door that when you sit with an individual, sometimes he doesn't represent himself, and you have to be a good listener. You know, you need to look at the other party's position, where he's coming from. And I think those representatives, they are coming from, you know, representing people of different thinking, different professions.
Yes.
So yes, they were, I think when we sit on a table, they sometimes talk in a different language because they are representing those people. So you cannot escape that fact. Yes. In Bahrain. This is the beauty of it. I think you might feel that when you read the law, you'll feel the sense of that the input has been because of individuals sometimes affecting the whole outcome of the law as such. So yes, it's very difficult to claim that this law is a masterpiece of someone.
Yes.
It is a masterpiece of a nation, I think.
Yes. Especially, as you said, because Bahrain's base unity or weave is all about cohesion and people talking to each other, and sometimes these experiences is the experience of one individual or one particular area, so you can't really base it on that. It's a general idea. Mr. Ebrahim, what are the procedures taken by the Supreme Council for Health to assess the success of the National Strategy for Health implementation? We talked about the follow-up, but how will you assess that it has succeeded or it is succeeding?
You see, I think it's more important, first of all, let's talk about how we go about implementing it, because people want to see the implementation happening. You know, we don't want to talk about something rosy in the future and we say it's going to happen, it's going to happen. We need to say what is happening, and I think then you need to, at the end of the day, you need to measure your success towards that. Yes, you will have to put the elements of success in front of you, KPIs, managing outcomes, you know, have your own business intelligence systems that follow all these indicators and see and tune as you go along. But it is important to say to the people, what should they expect next?
Yes.
Yes, we have the law, alhamdulillah, we have it in our hand. Now well, it is incumbent on us to implement the law. There is so much going on in the background. To do health insurance system is not going to one area and trying to change it. It's actually changing a whole system. Yeah. So we are looking at different aspects. How do we address the insurance companies? How do we address the private hospital? How do we address the private clinics? And then we come to the government. How are we going to restructure the Ministry of Health? And so on and so forth. So, if you look at the autonomy, for example, of hospitals, people in the hospital feel the change now. Yes. Because we've created teams, we are going to create project management offices in these entities. working with them to transform them. You might not see something on the surface, but you might see something happening for the nationals, towards the end of next year, that the system is up. You might just after 2 years say, okay, now you are introducing the system, but what happened in the background is happening now.
Yes.
So we are now implementing autonomy on the hospital. You will not feel it.
Yes.
We hope that you don't feel it. Yeah. The only thing that we want you to feel is the change and the effect of the change and the improvement to you. You just walk into the system, you feel everything is seamless.
Yes.
Okay? This is what we are trying to do with the autonomy. The same thing with Ministry of Health. We are now working with the Ministry of Health with
yes.
and all of them trying to really redefine their role in the new system. And this is happening. When did it happen? Yesterday. I don't mean yesterday, I mean, sometime. Okay? So it is happening in the background. Everything that we are talking about, it is actually taking place now. Yeah. So we hope, for example, for the expats, which is very, very important because they are the first people probably where they will affect the change or they feel the change. Starting about 4 or 5 months ago, we started to really focus on the expat and see how and who and when we want to realize these facts. And based on that, we put a clear roadmap to move into implementing the expat insurance. When they will feel it, it's going to be probably first or second quarter of next year.
Yeah.
But we are introducing systems. We are working with the Korean government now to introduce systems, and the systems some of them are near an end where they will be able to function. We are working with the health insurance companies. We are working with the private hospitals and clinics to prepare them to what to come, because they will be swamped. We are talking about 850,000 people really shifted to us. So you need to prepare them. You cannot say to them tomorrow it's going to be it. Secondly, there is a system which exists now. You cannot just cut it off and say, you see people, this is healthcare. You have to be very methodical in implementing the process as a whole. So people are, eager to see this change, and everybody wants to see when it's going to happen. It is happening.
Yeah.
And the actual implementation that you will feel it, hopefully for the expat of mid next year, and Bahrainis hopefully beginning of 2020. 2020, sorry.
As you said, the healthcare system is a continuous thing. There are people that are right now basically going through some of the steps that have been or are implemented previously and are being renewed. But the end user basically will have faster service, better service, basically different services or more choices for their illnesses or chronic illnesses or even short-term illnesses. Is there anything that you would like to add now at the end of the show?
No, I think it is very important to stress one point.
Yeah.
You see, the difference to the Bahrainis as such, we hope that they will, as you said, they will feel that the quality has raised, that the care somehow have changed, and the choice have become even wider.
Yes.
Okay, these are. But they should not think that, or actually the law is very clear about how much they will pay.
Yeah.
It is nothing.
Yeah.
Okay. I know through the media, a lot of people say, you're going to have this much amount of money to pay, or your card will be limited to this amount per year. No. That is all, I'm talking about the law. Based on the law, none of this exists within the law.
Yes.
You as a Bahraini, you will have access to the public hospital, and we have different packages. Maybe the time doesn't allow us to talk about all the packages, but the national, what we call the mandatory package for the nationals are very clear, that the Bahrainis can choose any public hospital to go to, choose his own doctor in the primary care, and will be treated for free. The amount of money for the package he will not pay, the government will pay. He will be treated, and the government will pay for that treatment. The medication is the same, okay? And even, inshallah, as we say, they don't require, but even if they require for overseas treatment, the system will work. as such, the government will support that as well. So the system as such is for the Bahrainis, hopefully, that the quality and the care will be different.
Okay.
For the expat, again, we are building a system where they'll have a choice of packages, but the mandatory package, which is a must for the employer to have for the expatriate employee, is to protect against illness. So that will be mandated for all of them.
Yeah.
For the visitors, okay, we have to, probably the GCC, by the way, GCC nationals, alhamdulillah, leaders of this country, the countries in the GCCs have mandated that they be treated the same. So we as a, in the government of Bahrain, and especially in the health sector, we go by the direction set by our leaders, and alhamdulillah there is no. But for visitors from other nations, yes, they will be mandated to pay a minimal amount to have access to accident emergency.
Yeah.
These, at the end of the day, that healthcare for everyone on the land of the kingdom will be somehow protected against any illness or any sickness that he faces. This is the whole idea. Yes, there will be options. There will be different options. Will you have access as a Bahraini to the private sector? I said I've been stressing to the public, to the public, to the
Yes.
public. What about the private? The private, yes.
Yes.
You will have. This is the first time. Now, if you want to go to the private sector now, what do? You have to go and buy insurance or pay out of your pocket.
Yes.
Okay, that's the two choices you have now. In the future, okay, and what I mean by the future is once we implement it, hopefully by next year, what will happen is you as a Bahraini will be able to go and buy from the insurance companies the what we call the optional package. The optional package, what gives you is open the horizon for you better to the providers of healthcare, the hospitals,
Yes.
the clinics. You will be able to go to these clinics. They will treat you. The only thing, the difference here, because we open the private sector to you, is the government will not let you pay completely out of your pocket. They will help you to pay the premium, which is 60%,
Yes.
minimum 60% as per the law. So before you used to pay all of your own pocket, now they will pay 60%.
Yes.
Plus, they will pay the bill, but you will pay what we call the co-payment
Yes.
percentages. Let's say the 10% out of that bill you will pay. So this is something that is completely new, but again opening the chance or the ability or the choice for you even to go to the private,
Yes.
which doesn't exist now.
Yeah.
So this is an idea of what we talk about options. So hopefully the whole program, is towards improvement and realization of quality care in the future.
Inshallah.
Inshallah.
Of course, the health insurance project is a very vast program, and talking about it is not going to finish within one episode. Hopefully, we will do a follow-up episode to see where we've gotten. I'd like to thank you, Ms. Ebrahim, for being with us and answering some of our questions today.
No, I thank you for inviting me, and I must take this opportunity to thank all those individuals who are working in the background to make this a realization. It takes a hell of a lot of effort to really do this, and there is much work. And thank you all for supporting us, hopefully towards improving healthcare in Bahrain.
Inshallah. Thank you so much, and thank you very much for watching us, and see you next week in Inside Edition.